Another procedure to review is accidental disconnection, and that ultimately means a wet contamination. So the patient's going to need a loading dose of antibiotics. It can happen in one of two ways. With the old type of titanium that was just a slip fit, if the patient is connected to their PD or something and it gets pulled, it can become disconnected so that the patient's implanted catheter becomes disconnected from the titanium. This is now garbage, needs to be replaced, and this generally results in a lot of leakage, and usually people find it in a panic and they grab a clamp in a hurry and clamp it off to stop the leaking, and now we need to reconnect to new equipment. The other way that this can come disconnected is fortunately or unfortunately not as dramatic, and that's simply because it comes apart at the titanium. Again, you're going to come across a leaking mess, and you're going to want to add a clamp in a hurry and then get your equipment to reconnect a new transfer set.
These are the supplies needed for this procedure: sterile gloves, sterile dressing tray, a couple of packages of 4x4 gauze, 2% chlorhexidine solution, a new transfer set, a mini cap, a mask for yourself and the patient, clean gloves, and a small white catheter clamp. You may be required to replace the titanium adapter, and this will require you to include scissors as your supply list. Prepare your sterile dressing tray with your gauze, chlorhexidine solution, white catheter clamp, and prepare your new transfer set on your sterile dressing tray. Close the twist clamp, remove the clear temporary cap, and replace it with the mini cap. Take your 4x4 gauze, lift the catheter, and continue by soaking the titanium adapter in the chlorhexidine. You may do this for a total of 3 minutes. Ensure that you dry the titanium adapter. Ensure that any excess chlorhexidine is not left inside the adapter by tapping it onto a gauze. Take your new transfer set, ensuring that the twisting clamp is closed. Attach it to the titanium adapter. You may now remove your clamp, and your procedure is complete. Perform any routine exit dressing site changes,
As required.
document your results, and your procedure is now complete. Next, you'll take your chlorhexidine soaked gauze and another sterile 4x4 gauze to handle your catheter. Soak the end piece of the catheter for at least a total of 3 minutes. Take another dry gauze and ensure that the catheter end piece is completely dry. Using your white catheter clamp, place it at the end of the catheter to help with easy handling of the catheter. Using your sterile scissors, you'll cut a 1/4 inch off Take your titanium locking device, place it on the end, then attach your new transfer set with the titanium at the end. Ensure that the catheter is secure. Then complete a twist that will allow for the titanium adapter to completely locked. Now you can remove your clamps, perform the routine exit site dressing change, document your results, and the procedure is now complete.